Dr. Cannon, you and I both see triggers all the time. We see trigger fingers, we see trigger thumbs, but I often get the question, what is a trigger? Like, what is that little painful dot or marble in people's hands?
Right. Trigger finger or trigger thumb is a very painful thing to go through. So the tendons go through a series of tunnels called pulleys. And when the tendons go through pulleys, inflammation can happen. There's many different predisposing factors that increase the risk of trigger finger. Diabetics, thyroid issues, etc. But what happens is there's just not enough room. So when the tendon goes through the pulley, there's not enough room where the pulley's too tight and the tendon will start getting inflammation, pain, and then ultimately it can start snapping as the tendon moves back and forth through the pulley. It can snap at the pulley and cause a very painful trigger finger. And many times patients will have pain right there at the spot where the pulley is, at the palm. It can have like a little bit of a mass or swelling. And typically the first line of treatment, anti-inflammatory, even a steroid shot to see if this will go away in clinic. Ultimately, if it doesn't go away with time and conservative management, non-operative treatment, surgery may be a reasonable option. Surgery takes about 2 minutes to do, where most patients could do this wide awake, you numb it up, small incision at a surgery center typically, and that pulley that's so tight, all it is just releasing the pulley, so now the tendon can slide back and forth, nothing's over the pulley, and you know that this is gone. Trigger finger, usually after surgery, they're moving right off the bat. The key to the trigger finger after surgery is motion, getting the finger moving again.
Because the tendon is now free, right?
Right, and with surgery, with patients being away, we test it on the operating table and make sure it's gone, so there's no triggering or popping.
Wait, they're awake?
Most patients are awake. It's optional, but most patients choose to be awake because that's the guarantee, the best guarantee that we can give a patient that the triggering is gone.
I hope there is some anesthesia involved.
There is anesthesia. Patients
okay.
are numb. We check it to make sure it is numb.
Perfect.
But once patients are done, as far as the surgery goes, they're working at home, moving right off the bat to get that motion back. And then some patients, as needed, many patients end up going through hand surgery or hand therapy to get that motion back and to help with the stiffness. As the hand therapist, what do you see as the biggest issue, the biggest limitation that patients have to have a successful result?
Scar tissue is the enemy of trigger fingers releases, I think. Because like you said, when that tendon is finally released, the body then piles on some scar tissue because it's natural. Like every body causes scar tissue. But the one thing we don't need in that area is something else limiting that tendon. So day one, first things first, we got to get after that scar tissue. We have to get it out of the way of what you fixed. On top of that, inflammation is a huge barrier here. Because of where it is in the hand, oftentimes this little area has a tendency to really swell up. And it happens after surgery. It happens after an injury. We can do a lot in therapy to turn both of those down, and they actually impact one another. The more swelling you have sometimes, the more scarring you have, and vice versa. So you, as the patient, and I have really got to turn those two factors down to allow the motion that, like you said, we have to get that motion back ASAP. So we do our best to get the motion, the swelling down, and the scarring down day one.
Do you find that braces help at all before or after surgery for a trigger finger?
I think there are some braces out there beforehand. Like if you have a trigger that you know you have, but it's not to the point where you're like, oh my word, get this thing off of my hand. There are some that are neoprene that are very lightweight, and all it does is that it prevents the finger from coming tightly all the way down. You can still function, you can still make a fist, it just pads and protects this little highway. After surgery, I think it's more important that we sometimes look at keeping the finger a little bit more straight. Functionally, we need to be able to bend our hands, right? We gotta be able to bend. But in trigger fingers, if that scar tissue is here, sometimes our fingers don't want to straighten. So we do have a couple of little braces that we put on the fingers just to gently stretch and straighten that finger up. Because as much as you want to be able to bend, you don't want to walk around like this the rest of your life either. You know what I mean?
Right.